Time now for Morning Rounds with CBS News chief medical correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. First up, opioid prescriptions. The substance abuse epidemic is one of the most pressing health issues in the United States, and opioids represent a large part of that problem.
A study published this week in the New England Journal of Medicine examined the role of emergency departments in prescribing opioids. Looking at over 350,000 Medicare patients, it found big variations within departments, depending on just who a patient saw. The study found what were termed high-intensity and low-intensity prescribers. Of the patients studied, 24% were likely to be given an opioid prescription if they saw a high-intensity prescriber, and just 7% if they visited with one described as low-intensity. Tara? So how does that affect a patient's long-term care, who they saw, in effect?
So as with many things in life, a chance encounter can potentially change the trajectory of your life. And in this case, that is what the research is suggesting, that which provider you see in the ER, a high-intensity prescriber or a low-intensity prescriber, can potentially increase your risk of becoming opioid dependent. And so, in fact, what they found was that those patients who saw a high-intensity prescriber were 30% more likely to use opioids long-term. And that by long-term, what they mean is for at least 180 days or more in the 12 months following their ER visit. In addition, they were more likely to be hospitalized for things like falls and fractures that were related to opioid use. So clearly, this points to an issue in the emergency rooms that needs to be addressed in terms of better education for ER physicians about when and how and who should receive opioids. And the numbers are really startling. I mean, they basically found in this study that for every 49 patients who got a script for opioids, one would become opioid dependent. Wow. And these were patients who were, in many cases, average age of 68, had dementia, had depression, had chronic lung disease, already a vulnerable population.
So, John, is overprescription the issue here? Do we need to be looking at how and when doctors are writing these scripts?
That's one very big problem, okay? About 250 million prescriptions are written each year. That's enough for a bottle for every adult in the United States. And almost half of all opioid overdose deaths are from prescription medication. And you know, the way that you die, one way you die is that this kind of medication depresses your ability to breathe, your respiration. And so you can die from that. And you know, one of the lessons here is that we have to start thinking about alternative ways of treating pain, you know, and these are things that have been called integrative medicine, alternative medicine, massage, acupuncture, acupressure, mindfulness techniques, you know, things that we don't just jump into giving drugs. And along with this, we have to have the insurance companies start covering it, which right now is not uniformly done.
You want to be a low-intensity prescriber, it sounds like. All right, next up, lower back pain. It is one of the most common reasons Americans head to the doctor's office. The American College of Physicians estimates that 1/4 of adults report having lower back pain one day in the past 3 months. This week, the same organization released updated guidelines for treating this pain, and some of the recommendations may surprise you. Dr. LaPook had a closer look.
76-year-old Berta Axelrad has lived with chronic low back pain for most of her life.
The pain is just so, well, it's terrible.
She swears by exercise, yoga, and walking.
It minimizes the pain. It's not always easy, but it's much better than doing nothing.
Today's guidelines say the first line of therapy should be non-drug treatments. For pain lasting less than 3 months, those include heat wraps, massage, acupuncture, and spinal manipulation. The authors stress that clinicians should avoid costly and potentially harmful treatments like narcotics. For pain lasting more than 3 months, treatments include stretching and strengthening exercises, Tai Chi, yoga, acupuncture, and mindfulness techniques like meditation to relieve stress. If those fail, anti-inflammatories such as ibuprofen should be considered first, then medications that can dull nerve pain like tramadol or duloxetine.
Some of these treatments, such as yoga or massage, are often offered outside of the traditional healthcare system.
Dr. Stephen Atlas of Massachusetts General Hospital wrote an editorial about the guidelines.
Some of these guidelines may be a shot across the bow to insurers to say that maybe we should be covering them better.
And then rotate once to your left.
Hospital for Special Surgery physical therapist Dana Rose demonstrated some moves designed to bring relief.
By activating and using your core muscles, that should lessen the load through our joints to help minimize back pain.
Okay, so John, medication is not recommended in the first line of defense.
Yeah, that was a little bit surprising. I was pleasantly surprised. I think in real life, people combine things. They give some anti-inflammatories and then some things like physical therapy and massage. But, we were talking about the risk of opioid addiction. It's nice to not start automatically with medications and then escalate.
Tara, with so many people experiencing lower back pain, there's a significant economic impact here, isn't there?
There is. And so in 2006, it was estimated that it cost our country $100 billion. And that cost is direct and indirect costs. So direct costs would be things like visits to the doctor, imaging like MRI tests and the prescription drugs. And then the indirect costs, which is 2/3 of that, was from lost wages and productivity. So really a big problem.
All right, finally, the role of certain plants in determining water quality. Seagrass meadows are among the most widespread coastal ecosystems on the planet, acting as a sort of natural filtration system. A new study published in the journal Science looked at the key role they play. It found in part that in places where seagrass meadows were present, there was a reduction of up to 50% in the bacterial pathogens that are capable of causing disease in both humans and wildlife. The authors highlighted the importance of these seagrass ecosystems in benefiting all forms of life. That's a huge number.
Yeah, and this inspired me to do some reading last night. And it's been 55 years since Rachel Carson's Silent Spring helped bring an awareness that nature was vulnerable to human intervention. And Rachel Carson said in 1963 on CBS Reports, right here, man is a part of nature, and his war against nature is inevitably a war against himself.
Seagrass.
Great
Same
quote.
true. It's true now.
Who knew? They are words to live by or think about as you live. Dr. Jon LaPook and Narula, always good to see you. Thanks for your time.